Hi, I'm Bill, the knee pain guru. Over the past 13 years since my own knee injury, as well as working with hundreds of clients, one of the things that I keep running into is how to get the most benefit for my clients in their conversations with their doctor. They go to their doctor and the doctor is essentially speaking a different language. You know, they come and share with me the reports that their doctor has, just they really aren't understanding what that means. So I wanted to shoot this video to really emphasize how you can get the most value out of your time with your doctor. It's important to understand that there's two aspects, two different types of injuries that you have with your knee. In both of them, you'd go to your doctor to get them checked out. One is going to be a mechanical dysfunction. The mechanical dysfunction means something is broken or torn. You've torn your meniscus, you've torn your cartilage, you've torn a tendon, a ligament, maybe even muscle. And that really fits into the paradigm that the doctor is able to help you with. Then on the other hand, there is another knee pain, another type of knee pain, and that's where nothing is broken or torn. And this is irrelevant of if you've had a surgery or not. So this can be pre-surgery or post-surgery. You have knee pain. You've gone to your doctor and they've done an x-ray, a CT scan, or an MRI, and nothing is showing up. There is nothing mechanically wrong with your knee. This is where you need to pay attention, because in that place, that's where we can have the conversation. The diagnosis that your doctor gives you, a dehydrated joint. They'll have a non-specific pains in the knee. There's all sorts of different types of diagnoses that essentially means the nerves that are only as big as an eyelash are being squeezed, and that's sending a signal to your brain that you have knee pain. Once we get that differentiation in the types of pain, then your strategy becomes clearer as to how you proceed forward in addressing your knees. With a mechanical dysfunction, that's when you consult with your doctor. That's when you talk about your conventional medical approaches to healing the knee. It may be an arthroscopic surgery. It may be you need a larger surgery because something is broken or torn, and that's something that's very important, that's the doctor's area of expertise. If it's not, then with that information that you're getting from your doctor, realizing that nothing is broken or torn, that's where my approach can be very beneficial, can be very helpful to you. Because my program is all about creating comfort in your knee, which takes the pressure off of those nerves and begins to set up the conditions so your knee can heal itself. So keep that in mind when you're speaking with your doctor in terms of getting that type of information. Now, from this place, when you have the nerves that are being squeezed in your knee, then what happens is there tends to be a slippery slope. And this is what it looks like. It first starts with you've gone to your doctor, you have knee pain. They may diagnose your knee as having degenerative changes. And that causes pain and tension, and over time it narrows the space in your knee joint. The tension, of course, your body's squeezing tighter together. That begins to wear away the joint. And then it gets further along and it gets diagnosed as arthritis. The arthritis gets progressively worse. The tension gets worse. The pain gets worse. The rubbing on the nerves get worse. The space continues to narrow in your knee joint, and then it's diagnosed as a bone-on-bone type of situation. And at that point, you become a candidate for a knee replacement surgery. Starts out with degenerative changes, arthritis, all the way to bone-on-bone. The idea in taking a preventative approach is we can begin to reverse that process. I believe your body has the infinite capacity to heal itself. It just needs to be given the conditions to do so. Now, can I say we can heal arthritis? That's not my call. However, if we let your body make the choice of what it wants to do, when we set up those conditions that it can heal itself, I believe the possibilities are endless. We just need to show it how to do so. And we start out by showing it comfort. So the next time you go to your doctor as a result of experiencing knee pain, get real clear on what category do you fall in. Is something broken or torn that needs to be fixed by the medical paradigm? Or are we just looking at nerves that are being squeezed, that are being rubbed on? Either case, you know now as to how you can approach your knee pain and feel empowered with the knowledge and understanding of your own body, and how you can make educated choices for your knees as well as for your life.